This is Selma Schimmel, and you are looking live at the great city of Chicago, which is once again playing host to the American Society of Clinical Oncology, ASCO. This is ASCO's 49th annual meeting, and this year's theme could not be more appropriate: Building Bridges to Conquer Cancer. More than 30,000 of the world's foremost cancer specialists are here, and so is the Group Room, making our 15th appearance at ASCO and one of our very best. Joining me now is Dr. Gretchen Kimmick, Associate Professor at Duke University School of Medicine and a breast medical oncologist. Welcome back.
Oh, thank you. It's always nice to be here.
And this year you got to moderate a educational session.
Right, on for patient and survivor care track, and we were talking about new developments in management of symptoms that patients commonly experience, like pain and hot flashes and depression, problem sleeping, just a kind of a smattering of things we tried to piece together.
What are some of the reasons that patients have and tell you about, when they can't sleep?
Well, treating breast cancer patients, I often deal with the issue of hot flashes, and I think that sleep and hot flashes kind of go together. People wake up with hot flashes, and if they sleep better, they have less hot flashes. And if they have less hot flashes, it's probably because they're sleeping better and they're less stressed.
What can you share about hot flashes in general?
I think that there's a lot of new developments in hot flashes going on, and Dr. Loprinzi really put a wonderful presentation together to talk about that. There's several antidepressants that are out there for prescriptions. There's some new information on progestational agents that can be used either intermittently or at low doses that probably don't affect cancer risk. That may be very, very helpful. But I always tell people to try the things that are not medication first. Exercise helps, and exercise also helps rest. Yoga has been shown to help, and that probably also helps us sleep better at night. Decreasing anxiety will decrease hot flashes, and actually improving the sleep quality helps improve anxiety, and overall well-being probably helps decrease hot flashes. So there's a lot of things intertwined.
Is there anything else at the session that really pops out for you?
We talked about pain, and Dr. D had a great summary of managing constipation and paying attention to constipation that people who are on narcotic analgesics get. She talked about different types of cathartics that help people avoid getting terribly constipated, and an injection that people can take up to every other day to help decrease problems with constipation. Fertility, things to help improve the fertility after cancer treatments, and the fact that we now can actually preserve eggs instead of embryos, so that we don't have to have fertilized eggs and two people hooked to the embryo instead of the woman's egg. And remembering to talk to men or young men who are going through cancer treatments about sperm banking, because it turns out that we forget to do that a lot. We still have to remember to do that, remind medical teams to not only treat the cancer, but think about what their life's going to be like after the cancer, and the hopes that we all have for family. We talked about lymphedema. That was exciting. Dr. Soren is in Pittsburgh, and he does surgical management for lymphedema. Now, I don't think that that's widely available, but if his results are as successful as he says they are, maybe it will be for people who have severe lymphedema. So that's exciting.
Dr. Gretchen Kimmick, Associate Professor at Duke University School of Medicine and a breast medical oncologist.
Thank you.
Thank you.